Welcome back to Prisk Orthopedics and Wellness, where our motto is, when in doubt, check it out. If you're watching this, it means we've determined that non-operative management of your condition is no longer effective, or that surgery is the most reasonable, medically necessary option within the standards of orthopedic care. However, it's important to remember that surgery, like any medical intervention, carries inherent risks. Understanding these risks will help us both mitigate them by identifying potential problems early. First and foremost, all surgeries carry the risk of infection. Opening the skin breaks an important barrier between you and microbial organisms. Factors such as diabetes, obesity, cardiovascular disease, compromised immune systems, and poor nutritional status can reduce your ability to defend against infections. Vices like tobacco, alcohol, and recreational drugs also increase infection risk. Even stress and an unclean home environment can contribute. Please work on optimizing your health, nutrition, and home before surgery. Watch for signs of infection, including fevers approaching 101 degrees, chills, night sweats, increasing pain, redness, drainage from an incision, purulent drainage or pus, and non-healing wounds. Contact us immediately if you experience any of these symptoms. Infections can also occur in other parts of the body, like the urinary or respiratory tract, and can spread to the surgical site or make you ill. Let us know if you have any signs of ongoing infection before surgery, so we can reschedule if necessary. Wound healing complications can depend on factors like the complexity of surgery, the location of the surgery, and pre-existing swelling. Elevating the limb when possible helps reduce swelling and tension in the wound, minimizing the risk of oozing or bleeding. Medical conditions, medications like corticosteroids, and social vices can affect your incision's ability to heal. Inform us of any concerning changes in your incision's appearance. We are always available to examine you in person or review pictures via email or secure text. Our office number reaches me or my nurse when the office is closed. Surgery involves making an incision and sometimes working near nerves and blood vessels. There's always a chance these structures could be damaged, leading to numbness, tingling, burning, chronic pain, or scarring. In rare cases, a vascular surgeon may be needed if blood vessels are injured. Blood flow problems in arteries can lead to tissue necrosis and compromised healing. Though rare, a blood clot could lead to the loss of a limb. This risk is higher in patients with cardiovascular disease, diabetes, autoimmune diseases, and tobacco users. All surgeries carry the risk of deep venous thrombosis, which can lead to pulmonary embolism, a life-threatening condition. We'll mitigate this risk with compression devices and encouraging movement after surgery. Some patients may need blood thinners, especially those with a history of clots or a family history of clotting disorders. Women on birth control and men on testosterone replacement therapy are also at higher risk for blood clots. Blood thinners, however, come with a risk of bleeding complications, which could require additional intervention. If you develop chest pain, shortness of breath, palpitations, a racing heart rate, sweating, or persistent fevers, call 911 immediately. When in doubt, check it out and call us. Your condition may not completely heal, may continue to cause pain, or you may have new problems. Every surgery carries the risk of needing another operation or ongoing treatments. I will review your specific condition and possible complications with you. Hardware used in surgery, like plates, screws, or sutures, may need to be removed in the future due to mechanical failure or infection. Physical therapy will be crucial to your recovery and optimizing your outcome. There is a rare condition called complex regional pain syndrome that can occur after any surgery. This often relates to nerve problems and anxiety about the condition. Taking vitamin C 1,000 milligrams per day can help mitigate this risk. I also recommend a multivitamin with minerals, protein supplements, and extra vitamin D to support healing. Another rare condition is compartment syndrome, where remarkable swelling causes constricting pressure, compromising blood flow.
Signs include severe pain, numbness, tingling, and blue or black discoloration of the extremity. Surgical decompression may be necessary in these cases. Anesthesia also carries risks related to positioning, the effects of anesthesia itself, and underlying medical conditions. You will need medical clearance with blood work and a physical exam before surgery. I know this is a lot to take in, but it's important to keep you informed about what to expect. This isn't an exhaustive list of risks, so please discuss any questions with me. When in doubt, check it out. Thank you for taking the time to review this information. My goal is to help mitigate surgical risks by recognizing problems early